Hey everyone. Today I'll be discussing the scenario in which a patient needs a barium swallow but refuses to drink the contrast medium and the nursing assistant forces the patient to drink it. This situation raises important legal and ethical considerations for the nurse in charge. First, let's consider ethical responsibilities. Nurses are guided by the principle of respect for human dignity, which is fundamental to all nursing practice. According to the American Nurses Association's Code of Ethics for Nurses, Provision 1.1 emphasizes that nurses must respect the inherent dignity, worth, and human rights of every individual. Ethical nursing practice requires compassion, advocacy, and allyship, ensuring the patients are treated fairly, with integrity, and that harmful acts or words are actively opposed. In this scenario, forcing a patient to drink a contrast medium directly violates this principle because it disregards the patient's autonomy and human dignity. Now, let's discuss the legal responsibilities. Legally, the nursing assistant's actions could constitute an intentional tort known as battery, when 2024 defines battery as harmful or offensive touching of another person without consent or legally justifiable reason. Importantly, battery does not require malicious intent, it only requires that the contact be unwanted and harmful or offensive. In this case, the patient clearly did not consent to drink the contrast medium, so the nursing assistant's action meets the legal criteria for battery. Nguyen also explains that any healthcare procedure performed without consent outside of an emergency may be considered battery, even if the intent was to help the patient. It's also critical to differentiate types of consent. Nguyen highlights that consent can be explicit or implied. Explicit consent involves a clear verbal or written agreement, while implied consent is inferred from a patient's actions or circumstances, such as rolling up a sleeve for an injection. For a barium swallow, consent must be explicit because the procedure involves swallowing a substance that the patient can refuse. Since the patient explicitly refused, any action to the force then constitutes battery. Next, let's address the patient's rights. Patients have a legal and ethical right to refuse treatment. According to ANA Provision 1.1, nurses must advocate for patients and protect their rights, ensuring that patients are treated with dignity and respect. Ignoring a patient's refusal not only violates ethical principles but also exposes healthcare staff and the facility to legal liability. So, what should the nurse have done? The nurse's responsibility is to intervene immediately to stop the nursing assistant, reassure the patient that their decision will be honored, and ensure the patient's safety. The incident should be thoroughly documented, noting the patient's refusal, the assistant's actions, and the nurse's response. The nurse should also report the incident through the appropriate chain of command. By taking these steps, the nurse protects both the patient and themselves from potential legal consequences. Finally, the nurse's ongoing responsibility when a patient refuses the treatment is to ensure the refusal is informed and voluntary. This involves verifying that the patient understands the risks and benefits, confirming competence, documenting clearly, and notifying the provider to discuss alternative options. In summary, the scenario illustrates how forcing treatment without consent constitutes battery, a serious intentional tort, and violates ethical standards set forth in Provision 1.1 of the ANA Code of Ethics, which emphasizes respect for human dignity, patient autonomy, and advocacy. Nurses must protect patient rights, intervene when harm occurs, and document thoroughly to maintain ethical and legal standards. Thank you for listening.